Having your blood taken at the lab is usually the easy part. Understanding what your results mean and what to do about them is much harder. Doctors seldom have the time to go through the details of a cholesterol test with their patients. They often focus on a single value for total cholesterol to simplify the results. This leaves patients feeling that they don't really have a grasp of what the numbers mean. Your cholesterol test results provide 4 numbers that can have an influence on your heart health. They are total cholesterol, HDL, the good cholesterol, LDL, bad cholesterol, and triglycerides. By themselves, these numbers do not predict your heart risk. Your cholesterol results need to be interpreted in the context of your overall health, which includes factors like your age, body mass index, smoking, and exercise levels. Family history and the presence of other diseases such as diabetes and high blood pressure are also important. There is one easy to calculate ratio that can predict your risk of heart disease, which I'll show you towards the end of this video. Total cholesterol. This is the number that people usually quote when discussing their cholesterol. On its own, total cholesterol is not really that informative. In general, values of below 8 millimoles per liter or 300 milligrams per deciliter are acceptable and can usually be managed by diet and exercise. This, however, is not what most doctors believe, and many will start you on a lifetime treatment with a statin drug in a heartbeat. The current guidelines suggest that values of below 5.2 millimoles per liter are desirable, and values of over 6.2 millimoles per liter are treatable. If you wish to learn more about cholesterol and the billion-dollar statin industry, a good place to start is the book by Dr. Stephen Sinatra called The Great Cholesterol Myth. LDL, usually called the bad cholesterol, which may not be true. Lower LDL numbers are better. However, the size of the LDL particles is important and can only be measured by sophisticated tests. HDL. Higher values are thought to be protective. Many studies have shown reduced levels of heart disease in patients with higher HDL levels. Increasing your HDL levels is a good idea, and there are ways to increase HDL levels without taking medication. These include exercise, weight loss, taking more omega-3s, vitamin D supplementation, stopping smoking, and eating less sugar. Triglycerides. Triglycerides are used to transport excess carbohydrates around the body. In my experience, high triglyceride levels are often related to excessive consumption of grains and sugars. High triglyceride levels are predictive of increased heart disease risk. Lastly, and most importantly, how do you use your cholesterol results to tell what sort of shape your heart really is in? The evidence is quite clear that total cholesterol is a poor predictor of heart disease. Although various ratios of the 4 cholesterol numbers are used by doctors to predict risk of heart disease in their patients, by far the most reliable is the triglyceride to HDL ratio. It is easy to calculate. Simply divide your triglyceride results by your HDL value. This will give you a number between 1 and 10. The lower your result, the lower your risk of developing heart disease. A result of 2 or less is ideal. A result of 4 over is high, and over 6 is too high. A study published in 2008 reports that a raised triglyceride to HDL ratio was the single most powerful predictor of extensive coronary heart disease among all variables examined. The good news is that if your ratio is high, you can reduce it by lowering your intake of sugars and grains, which will lower your triglyceride levels. You can also increase your HDL levels using the methods discussed earlier in this video. Take control of your health without resorting to a life sentence on statin drugs. Thank you.